The doctor is in. 19 years after the Philippines was declared polio-free, the deadly disease is back. Health officials say polio is reemerging after a 3-year-old girl from Lanao Del Sur was diagnosed with the disease. But she's not the only one. Today, the program will take a closer look at this unexpected and deeply concerning development. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk right here on CNN Philippines. Polio, which is short for poliomyelitis, is a crippling and potentially deadly infectious disease. It is contagious. Polio can affect a person's brain and spinal cord, thus causing paralysis. The last known case of polio in the country was in 1993. But why are we now seeing cases of polio in the country? And to talk more about this contagious disease, we have in the program Dr. Salvacion Gatchalian. She's a pediatric infectious disease specialist and current president of the Philippine Pediatric Society. Welcome to the program, Doctora.
Thank you.
Last time we've seen polio here in the Philippines, 19 years ago, so long ago. Why is it back?
There are actually 3 basic factors that's responsible for why the polio virus has actually reemerged. But it's not the wild type polio, so these are like vaccine-derived polio viruses. One, very important, is the very suboptimal immunization coverage. Because for polio to be eradicated, for it to provide herd immunity, there should be a 95% immunization coverage.
Okay.
Second, there's poor sanitation and hygiene. Sometimes very difficult to address, especially with the lower strata of the environment of the Philippines.
Demographics, yes.
And then third is actually the poor AFP surveillance, what we call the acute flaccid paralysis surveillance. Because for the acute flaccid surveillance, we should be reporting at least 2 per 100,000 population cases. Now, our reporting is less than 1, so
Okay.
we're way below the required surveillance numbers.
Okay, so all of those criteria met, hence we saw an emergence of that. You mentioned, Doctora, that this is not the wild type of polio as compared to this is a vaccine-derived type of polio. Could you explain to us the difference?
Okay, it's called a vaccine-derived poliovirus because when the virus is excreted in the human waste, the virus actually type that is from the vaccine. So it's a Sabine strain.
Okay, so is it important to distinguish that this is not the wild type?
Oh,
of
yes,
polio virus?
definitely, yes. What's scary is we've eradicated the wild poliovirus. We've not seen it since 1993.
Okay.
So that's very scary if it does reemerge.
Why should the regular Filipino be concerned about polio coming back?
Because these viruses can also cause some form of paralysis. It can also cause the same manifestations as that of the wild-type poliovirus. So people should be concerned because it can cause not only paralysis, but in fact, it can also result in death.
Okay.
So the major thing here is vaccination coverage.
Okay.
So people really need to have their kids vaccinated.
Okay. So before we go further, Doctora, for those who aren't that quite familiar, could you explain to us what exactly is polio?
Polio, or poliomyelitis, is a very contagious infectious disease. It is caused by your by your polio virus, and it actually attacks the spinal cord, and it can attack the breathing as well. The brain can be attacked as well.
Now, who are most susceptible to poliomyelitis?
Children, particularly those less than 5 years of age, are most susceptible.
Okay, but adults can be infected by polio as well?
Very, very rarely, because they've been exposed before. There has been some immunity because before we had good immunization coverage, and adults would have had some form of immunity already.
Okay, now on the extreme end, Doctora, you mentioned how it can cause breathing troubles and eventually death, as well as paralysis. What other outcomes can we expect from polio on the extreme end?
95% of cases who get the poliovirus are asymptomatic. It's only about 4 to 8% who become symptomatic. And of those, about 1% will get the paralysis.
Okay, and we'll talk more about that, Doctora, but first we have to pause for a quick break. There is no cure for polio. It is infectious and contagious. And when we return, we'll talk about the signs and symptoms of this polio virus. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk, only here on CNN Philippines. This is MedTalk Health Talk, and I'm Dr. Freddy Gomez. The polio virus can spread from one person to another by the fecal-oral route, and that is why we need to maintain good hygiene. Let's discuss a little more about the signs and symptoms of this disease. Still with us is Dr. Salvacion Gatchalian. She's a pediatric infection disease specialist. Okay, Doctora, so now let's talk about some signs and symptoms of someone who is infected already with the polio virus.
Just to make things clear,
Yes.
there are actually two types. No? One is what we refer, first of all, like I said, 95% of cases are actually asymptomatic. And those who become symptomatic, there are two types. One is what we refer to as non-paralytic polio, or the abortive type, and the other one is the paralytic polio.
Okay, let's start first with the non-abortive.
The non-paralytic, because that's the majority.
Right.
Like I said, only 1% with the paralytic. So the non-paralytic or abortive type is very much like flu-like symptoms. They have fever, they have sore throat, they have headache, they can have vomiting, they can have arm and leg pain or stiffness, muscle ache, neck pain and stiffness, back pain and stiffness.
Symptoms very similar to
Very
having the flu.
similar, yes. They can have fatigue as well.
Okay, should they be alarmed then? Should everyone who feels these types of symptoms think of, instead of having the flu, baka may polio na ako? Should they be concerned?
For older people, probably not. But for kids, there's so many other diseases now, so it's very non-specific. And if this were a paralytic polio, that patient will have the same signs and symptoms that we'd see with non-paralytic polio, but it will progress. You will lose reflexes, there will be more severe muscle spasms and pain, and there's flappy weakness. Usually it is asymmetrical. One side is more affected than the other.
So is there a time frame in which these symptoms would occur for the paralytic type, for the loss of muscle tone, for the flaccidity of the muscle?
It can happen in a few days after the onset of symptoms.
Okay, but would you suggest, most important, if they are ever in doubt, if anyone is ever in doubt, to go see a doctor
Of course,
right away?
definitely. So if you're in doubt and you have this, in fact, even if it's not polio, for anything where you have fever and you need consult, you have to seek consultation with your physician or maybe the local health centers.
Okay, now let's talk about prevention naman, Doctora. So the best way to combat this is prevention. Could you explain to us first exactly how this polio is transmitted from one person to another?
It is transmitted via the fecal-oral route.
Okay.
So for example, a person touches a human waste that is contaminated with the virus, and this individual then eats food without washing his hands properly, then the virus can enter via the mouth, and then it can stay in the intestine and, replicate in the intestine.
Okay.
So that's how that's the major transmission of the virus.
So other people think na baka someone who sneezes, someone who through blood contact. So the main route of transmission is through the feces and it is
Fecal oral,
ingested.
yes. Although if you get in contact with a person who has active polio, then, and the coughing and the sneezing may also, but it's very rare to
Okay.
get that. Because generally, like I said, it's more flu-like symptoms, not cough really, more of muscle spasms and pain.
Are we concerned of the speed in which polio can be spread?
First of all, there are two cases, one in Lanao and the other one is from Laguna.
Okay, Laguna,
So those
yes.
two cases from Laguna.
Should
If we do
fast-
not stop the
Right.
transmission, then this can actually spread. So now we're trying to identify cases. So the government is really doing intensive surveillance, trying to look for cases,
Okay.
because it can spread.
And one of the best ways to prevent this is through vaccination as well.
It's the only way. There is no treatment for polio, and the only way to protect our children, especially those less than 5 years of age, is vaccination.
Now, even with vaccination, there are two types of vaccines that are available. Could you explain to us these?
Okay,
these
there are
types?
two types of vaccine. We have the oral polio vaccine that's administered obviously orally, and the inactivated polio vaccine, which is administered intramuscularly. So that's the one that is injected. The oral polio vaccine, it's an attenuated vaccine. So it's a live virus, but it's attenuated.
Okay.
So it is a weakened type of virus. Whereas the inactivated polio vaccine is an inactivated vaccine or a killed vaccine. The oral polio vaccine produces antibodies in the blood as well as in the gut. The IPV produces antibodies in the blood, but the virus can replicate in the gut and can still infect people.
Now, a lot of people are concerned. They ask me, Doc, if there are two types of polio vaccines available, am I covered if I just take one, or should they avail of both para safe daw?
Okay. If one has had primary, at least 3 doses of either the oral polio vaccine or the inactivated polio vaccine, that is already safe. But we encourage our patients that if the Department of Health comes and knocks at their door, and the patient is or the kid is less than 5 years old,
right,
and they say, oh, we need to give oral polio vaccine, then they should let the physicians or the health center workers have their kids be given the oral polio vaccine, because the combination of the inactivated polio vaccine plus the oral polio vaccine makes or improves immunity of the individual.
Okay. Now, what about those, Doctora, who aren't sure? Nakalimutan na nila. They don't recall if they've ever had a polio vaccine when they were younger. Is it okay for them as an adult to be given the vaccine?
Usually, the recommendation is to give the inactivated polio vaccine those older than 5 years old. So what we recommend is giving the inactivated polio vaccine.
Okay.
Oh, let me just clear it as well. Between the two, the oral polio vaccine is the only one that can stop transmission because it can limit the replication of the virus in the intestine.
Okay. So that's
IPV cannot do that. It's only the oral polio that can limit transmission and therefore stop the transmission. It will limit the replication.
And when we return, we've emphasized how important it is to immunize children below 5 years old. But what about if you're an adult? What is the best way to protect yourself as an adult? All these and more when Med Talk Health Talk returns, only on CNN Philippines. Welcome back to the program. I'm Dr. Freddy Gomez. The most serious form of the disease is paralytic polio. It is actually rare. Only about 1% of polio cases can develop into paralytic polio. And it happens when the virus attacks the nervous system. The condition is characterized by severe back, neck, and muscle pain, which can develop into the muscles getting weak, loss of reflexes, and paralysis. I spoke earlier to someone who developed paralytic polio. Let's listen to part of our conversation.
My feelings that I got the polio already, and maybe my parents forgot to give me or get me vaccinated. So yun ang feelings, so naunahan ako ng polio bago ako nabakunahan.
What extent has the polio virus given for you with regards to your mobility?
Lucky for me kasi yung mga friends ko, they got the side effects affecting the upper and lower extremities. But me, it's just the lower extremities, my legs.
It is difficult for you to move without a wheelchair or without crutches.
Yun lang. So medyo hindi naman ako naapektuhan yung kamay ko, kaya I'm still very thankful kasi yung iba kasi mas matindi yung mas pwede pang naging matindi yung cases kasi hindi na makagalaw yung kamay nila.
Do you think any of these challenges has ever halted you or slowed you down in life?
Honestly, hindi po. Nagpapasalamat ako kay God na in spite of this condition na nangyari sa akin, He gave me the strength to overcome it. And I really did not feel that I have to give up. I feel more of doing my best, and luckily every time I try to strive hard to achieve my dreams and whatever I want to do, na-achieve ko naman.
If you had one message for people who are watching this with regards to polio, what can you tell them about polio?
Mahirap yung buhay ng mga may naging biktima ng polio. But we should not think of it as the end of the world. What we lost is not important, but what is left is more important. So yun ang ating pagyamanin. So we should not give up. We can still succeed.
And again, we want to make it clear that paralytic polio is rare. Only about 1% actually reach the point of having paralysis. Doctora, do you have any comments with our case of Mr. Crispaner?
It's really very unfortunate that he had polio, and he says that he had polio when he was 8 months old.
Right.
And we know that the polio vaccine is actually administered at 1.5 weeks, 1 month and 1 week. So that's 1.5 months, 2.5 months, and 3.5 months. But what is amazing with Mr. Chris is that, you know, it wasn't an end all for him, for the polio. He really strived so hard. He even had a master's degree.
Right.
He even has 5 kids.
It was a challenge for him, but it wasn't a hindrance
Yes.
for him. Now, Doctora, for other adults naman who are concerned whether or not they have the polio virus, should they get the vaccine, should adults be concerned about being infected with polio just as much as those who are 5 years old and younger?
I'd just like to emphasize again that our priority are children less than 5 years of age. Okay? Now, the Philippine Society for Microbiology and Infectious Disease and the Philippine College of Physicians actually came out with a guidance. And they have identified 3 adult populations that would probably need to be vaccinated. So one, if you're traveling to an endemic area such as Pakistan and Afghanistan, because these are the only 2 countries that still have the wild polio virus circulating. If you work in the laboratory and you deal with the polio virus, then you need to have the vaccination as well. And individuals, healthcare workers, are actually attending to patients with polio virus infection. So these are the individuals that really need to be vaccinated. For adults, you can actually protect yourself by first, hand washing still remains to be a very important infection control measure. And then eating good food, well-cooked food. Clean water, so we suggest that for water from the faucet, to boil it and have it reach boiling, yung bubbling for about a minute before you cool it down. So things like safe water, hygiene, are measures for adults so that they can prevent themselves from getting the polio. Because majority of them would probably have had immunity.
Okay, very well said, Doctora. But before we go, do you have a message for our viewers out there?
Well, polio has actually reemerged, and it's really going to be scary because we were declared polio-free in 2000 together with other Western Pacific region countries, and kids less than 5 years of age are the ones that are vulnerable to polio. So I would like to beg our viewers, the mothers, the parents, to please bring their kids for vaccination and make sure that their kids are vaccinated against polio and all other diseases, because other vaccine preventable diseases are administered together with polio at 1.5 months, 2.5 months, and 3.5 months. We need to stop the transmission, and the only way to stop transmission is with the use of the oral polio vaccine.
Thank you again, Dr. Salvacion Gatchalian, for sharing your expertise and your knowledge with regards to this very trending topic of polio. Please do join us next time as we give you more topics that help take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.